All right, although physical health is a top priority for most Ohioans as we battle the spread of COVID-19, dealing with the uncertainty of this worldwide pandemic and social distancing can really take a toll on one's mental health. So Audrey Hassan spoke with Dr. Delaney Smith. He's the medical director of the Alcohol, Drug, and Mental Health Board of Franklin County, better known as ADAMH. He's got some ways to help.
To start off with this uncertainty that we're living in, these unprecedented times with COVID-19, it's taking a toll on everyone. Stress, we're asking questions. Do I have it? Do I have the symptoms? What are some of your tips for stress management during this time?
Yeah, it really is a great time of uncertainty for a lot of people. And unfortunately, that uncertainty can manifest itself as anxiety. So, when we don't have control over our environment, we can get very nervous, and then we'll do things to try to take control. And sometimes those things don't make a whole lot of sense, like, buying a lot of toilet paper. But it's something that people do that is sort of reassuring to them that I'm bringing back a little control to myself. So what we really want to see is that people are using healthy coping strategies to deal with that uncertainty and that anxiety. So, if people have a little kind of mild to moderate amount of anxiety, there's a lot of things they can do to help themselves. We really emphasize that people reach out to one another. So, we want people to be socially distanced, but not emotionally distanced. So, whether it's FaceTiming with a friend, writing a letter, calling someone up, don't just text people, but, really have that conversation and that connection with other people around you. The other thing we have been talking a lot about is, find things that you enjoy. So for some people, that's being outside, taking a walk, but keeping that distance. For other people, it's something like music, music that you have always enjoyed, that's uplifting to you. It might be doing some artwork. This is a great time to reestablish some of those hobbies and pastimes people maybe used to enjoy, things like knitting that are kind of calming and relaxing. So, there's a lot of things like that people can do. Exercise is wonderful for anxiety and depression. And right now, there's a lot, I think, of exercise programs that are making themselves available to people. So there's a lot of apps and Facebook groups and websites that are putting out a lot of content. So people who even don't exercise regularly can kind of slowly get back into that and get those good, healthy endorphins kind of kicking in again. Meditation, mindfulness, yoga are all great things to help with stress. And again, all things that we're so lucky in these times to have, available on our phone or on our computer to kind of look up, even if you've never done it before. For some people, that anxiety really moves, though, from that sort of mild, moderate into the more severe. And if people are getting to that level where, they're just not able to enjoy things anymore, they're finding that, their appetite's impacted, they're more short with their loved ones, maybe they're not wanting to get out of bed, things like that. That's when we really encourage people, reach out to someone who is a professional and who can talk to you. And there's lots of providers who have really answered this call and, have become, they've really moved into this space of telehealth. So, they want to be there for people. They want to be available while still making people feel comfortable in reaching out.
Now, a lot of parents are staying home with their children. What would you tell those parents as the kids are asking questions about COVID-19?
Yeah, and it's good the kids are asking. That shows that your child is comfortable with you. They have that open relationship. So that's a great thing if your kids are coming to you and asking. You want to be open so that they feel like they can keep that communication flowing and, answer their questions in a sort of age-appropriate way that's still reassuring. And again, even kids want that control. So reminding them, these are what we're doing as a family to keep ourselves healthy. This is how you, the child can be involved. Let's, go practice washing our hands. Let's, write a letter to some people who maybe are in a nursing home and can't get out. So things that kids can do to have that sense of control brought back is really helpful to them as well. And the best thing parents can do is really lead by example. So, show them that you're calm, that, you're taking this day by day, you're taking your health seriously in terms of eating well, sleeping well, getting enough exercise and fluids. Those are the things we can really do for the kids that I think is reassuring, in addition to keeping up with that kind of normal schedule.
Absolutely, doctor. And How about for someone who already has a pre-existing mental health condition or substance abuse issues? What advice would you give them?
Yeah, so times like this, where there's a disaster, this can be upsetting to people who don't have a mental health condition, but those who already have been struggling with mental health issues, this can further destabilize what's been going on. It's really important that people reach out to their providers, keep in touch with them, not assume that just because their front door might not be open, that doesn't mean that they're not providing services. Because again, at this point, all the providers in the ADAMH network are still providing services. It just might be in a different format. So we want to keep those connections strong, encourage people to keep taking their medicine, don't make any changes on their own. There's the peer warm line is available for people who do have a history of mental health and addiction issues, and they have expanded their hours, which has been really helpful in response to this. Their number is 614-358-TALK. So that's somewhere that, people can talk to other people in recovery, other people with mental health concerns, and, just kind of, again, share that camaraderie so that people don't feel like they're socially isolated.
For our viewers, if they'd like more information or how to contact you and your providers, doctor, where should they go?
The ADAMH website, we keep our provider network. Their websites then are listed there. So that's ADAMH, ADAMH, Franklin.org. And if anyone ever is in crisis where they're feeling unsafe, we work with NetCare to provide crisis services in the county, and that's 614-276-CARE.
Thank you so much for joining us today, doctor.
Thank you.